This is a class for me. I'm Su Shan Yu and UKTATM. This is a sample class. I hope you like it. First, today's topic is Chapter 9, Female Infertility. Okay, the definition of female infertility is for a woman who have been conceived after 12 months of regular intercourse without the use of contraception. If she haven't been pregnant, we will diagnose she has infertility. This is for female who under 35, and for female who over 35, the time of the diagnosis will be reduced from 12 months to 6 months. And the prevalence of female infertility is about 3.5% to 16.7%. In developing area, it's about 9%, and in Taiwan here, it's about 10 to 15%. And the cause of female infertility, it's about 4.6% have multiple factors, and for 16.7%, the cause is tubal diseases, and for 4.9% is ovulatory disorder, and for 18% is unexplained, no reasons. In Chinese medicine, there are 4 pathogenic pathways for female infertility. The first is kidney deficiency, and the second is liver constraint, and the third is phlegm, and the fourth is the problem of blood stasis. The kidney deficiency is the basic cause of infertility. Overconsumption or congenital kidney deficiency would cause the kidney deficiency patterns, and the kidney is control reproduction. If we do not have enough kidney qi or kidney essence, it would cause reproductive disorder. And the second pathogenesis is liver constraint. If a female she is under pressure for a long time, or she has mood swings, it will cause the flow of qi unsmoothly. So unsmoothly flow qi would make qi and blood imbalanced, and that imbalance would cause infertility. And the third reason is phlegm. The phlegm would be generated by cold or by obesity. Nowadays, many females have the problem of obesity. Obesity is a problem, a pattern. It is a pattern in Chinese medicine. It is a pattern of phlegm. And the pattern of phlegm, the phlegm would obstruct the vessels and would decrease the flow of qi and blood, and decrease the flow of the liquid inside the body. And the phlegm also obstructs the vessels of the uterus. It would generate infertility. And the last reason for infertility is blood stasis. The blood stasis would be generated because of qi stagnation, or because of any other reasons, such as surgery. If a female she have been undergone DNC surgery, or she has been experienced abortion several times, that would make blood stasis pattern inside the uterus, and that kind of pattern would cause infertility. Okay, so that's 4 pathogenesis for female infertility, the kidney deficiency, and the liver constraint, and the phlegm, and prosthesis. So let's talk about the treatment and diagnosis for the 4 patterns. The first is kidney deficiency. The etiology of kidney deficiency, it would be like congenital qi is insufficient, or a person who is who have overconsumption of her qi, like who stay up late, or who has a midnight duty, do not sleep very well, or it's a nature degeneration, like aged, not so old, but about over 40 years, the female would lose her pregnancy ability naturally. Also, that would lay out the cause for kidney deficiency. And kidney deficiency, we can categorize into several sub-patterns. The first is kidney qi deficiency, and then the second is kidney yang deficiency. These 2 patterns always combine together. The kidney qi would become combined with the kidney yang deficiency. And another part is kidney yin deficiency. The kidney yin deficiency would generate heat, and all the kidney deficiency pattern would have kidney essence deficiency. So the kidney essence deficiency is the core pattern in the kidney deficiency pattern. And how to diagnose kidney deficiency pattern? Usually, the female would have abnormal menstruation, like early menstruation or late menstruation. And for kidney yang deficiency, more female have delayed menstruation, and the flow is thinner than normal. And then the patient would have some symptoms like cold limbs and aversion to cold, and pale tongue and weak pulses. And for female who want to get pregnant, we always ask patients to check their basal body temperature. And for kidney yang deficiency, the female would have low basal body temperature. The temperature become lower than normal. Moreover, the patient would have shorter luteal phase. Shorter, it means the standard luteal phase, the day for standard luteal phase will become 12 to 15 days. But for female with kidney yang deficiency, the luteal phase would be shorter than 12 days, or the temperature would be lower than 36.7 Celsius degree. The treatment principle for kidney yang deficiency would be we need to warm the kidney. So the suggested formula would be 大营间. This formula is from the complete works of Jing Yue. That's a famous book in ancient China. And in this formula, 大营间, we have 当归, 熟地黄, 枸杞子 to supplement the essence of the kidney, and to tonify the kidney, the blood and essence for the kidney. And then in this formula, we also have 杜仲 and 肉桂 to warm the kidney. And then we have 怀牛膝 to tonify kidney qi. Then the last one is 炙甘草. This is an herb to strengthen the spring and tonify qi. And this is a whole formula for of 大营间. We also add 紫河车, 八极天 or 覆盆子 if we need to tonify more kidney qi. And we also add 白术 to strengthen the spring more. And then the second pattern for the kidney deficiency is kidney yin deficiency. Kidney yin deficiency, the patient would also have abnormal menstruation. Usually, the patient have less amount of menstruation flow, and the color of the flow would be bright red, and the patient would feel the sense of heat or the heat during the night or in the middle of night, and the patient, when patient feel the heat, patient would also get sweating, and sometimes patient can get tidal fever and Mara rush. And the tongue of the patient of kidney yin deficiency, the tongue will be red and maybe little coating, and her pulse will be thin and rapid. And for the basal body temperature of for kidney deficiency patient, the follicular phase will become shorter than normal. Usually the normal follicular phase need to be more than 10 days or 12 days, but sometimes in patients with kidney yin deficiency, the follicular phase will be shorter than 10 days. And the basal body temperature in kidney yin deficiency patient will become unstable. Sometimes it goes high and sometimes goes low, and you can see the basal body temperature become like unstable basal body temperature in both the follicular phase and the luteal phase. And the treatment principle for kidney yin deficiency would be nourish in and clear heat. So let's talk about formula for kidney yin deficiency. First, the formula kidney yin deficiency we can separate into two types. The first type is the kidney yin deficiency without heat, and the second type is kidney yin deficiency with heat. So let's talk about the first type. The first type, when a person have kidney yin deficiency without heat, we give the person 左归饮. 左归饮 is also from the complete work of Jin Yue. In this formula, we have 熟地黄 to supplement the essence and the yin for the kidney, and we also have 山茱萸枸杞子. It's tonify both kidney yin and the blood of the liver, and we also have 茯苓 and 炙甘草 that would strengthen the spleen and tonify qi. And then we have 山药. It will strengthen the kidney, and it's also tonify the kidney qi, and it's also strengthen the spleen. And for the second type of kidney yin deficiency, it's the yin deficiency with heat. So when the person have this kind of pattern, the kidney yin deficiency with heat, patient would have heat symptoms, like patient would feel heat in the center of the palm and the foot, and feel heat in the body. Then we need to put in some herbs to clear the heat. And the standard formula in this textbook is 一阴间. 一阴间 is also from the complete works of Jin Yue. It have 白芍药、麦门冬 and 生地黄to nourish in and clear the heat. And then it have 丹参 to clear the deficiency heat and cool the blood. And then in this formula, it have 熟地黄 to supplement the kidney essence and the kidney yin. And then we have 怀牛膝 to tonify kidney qi. And then we have 炙甘草 to harmonize the whole formula and harmonize the body. And then we have another formula for kidney yin deficiency with heat. It's called 养精重郁汤. It's from Fu Qingzhu's Gynecology, the book. The book, Fu Qingzhu is also famous for its treatment for females. And in this 养精重玉汤. We have 熟地 and 白芍药, these two herbs, to nourish the liver and nourish the blood and also tonify the kidney yin and kidney essence. And we have Dang Gui and Shan Yu. They tonify the kidney yin and they also supplement the blood. And if we want to clear the heat more, we add mudan pi into the formula. We can also add 地骨皮, 黄白 and 龟板 into the formula. And that would increase the ability for this formula to clear the heat. Okay, should we stop here?